Hello, I'm Albert. I'm a PhD student in University of Oxford, and I'm gonna talk to you about protease inhibitors. So, as you all know, we are talking about this coronavirus. That's a virus. So, how do we tackle it? The easy solution is an antiviral. So that's what people have been searching in the internet. These are the searches in the internet for and in Google for antivirals. And as you see, there's a very high peak on the past month searching for that. And we go to the next slide. We can see that researchers have also thought of this. So there's been a great number of new trials being registered and that are being conducted right now. And there are some, and a lot of those are about antivirals. And when we look at these trials, we see that some viral infections and viral diseases came out a lot. And those are HIV and hepatitis C. Next slide, please. And so we're going to look at effectiveness and safety of these antiviral drugs that are used for these two diseases, HIV and hepatitis C. Our colleagues from the literature review team have done an awesome job finding all the literature there's on this. And they found out that HIV antivirals have been tried on SARS patients and they seem to work. We are not sure about COVID patients. There's been a New England Journal of Medicine published trial, but there are few patients. So we are waiting for more information on this. Hepatitis C antivirals have only worked in vitro. And another thing we know is that these drugs have an interesting safety profile. So if we're thinking of giving these drugs to otherwise healthy patients, we have to know a little bit more about how these drugs, what kind of harms these drugs can do. So we've prepared some estimation studies. In the next slide, we can see for the HIV antivirals, we're looking at a self-control case series that it's currently packed and ongoing in the databases, and a cohort study looking at patients who initiate treatment for first time for HIV with these drugs. Next slide, please. For hepatitis C, we're doing similar analysis. We're looking at all hepatitis C antivirals that are being tested for COVID in the same way with a self-control case series and with cohort studies. And in the next slide, we also are going to look at effectiveness of these drugs. So we're going to look at patients with that have been tested positive of coronavirus and look how many go to have hospital treated pneumonia, or in those that have a pneumonia, what antivirals are good for preventing poor pneumonia outcomes. And in the next slide, so this is what we've done so far. There's a protocol that's already done. Safety analysis has been finished and have been finished being planned and packed, and they've started to run in different databases. Effectiveness analysis, we're waiting to have coronavirus database is available, and we started writing papers and manuscripts about our results. And we already have a background on method writing, but we'll be working more on this in the next weeks or months. And yeah, with this, I'll hand over to Daniel, who's going to talk to us about ACE inhibitors.